Number 4. Itchy hands and wrists. Itchy hands and wrists might seem like a minor issue, but in some cases this can actually be an indicator of a more serious heart condition. When the heart isn't pumping blood efficiently, it can lead to fluid retention and swelling, which may cause itching in the hands, wrists, and even the lower extremities. This is especially true for seniors with conditions like heart failure, where the heart struggles to pump blood effectively to the body, leading to fluid buildup in the tissues. The skin may become irritated as it stretches to accommodate the excess fluid, resulting in an itchy feel. Take the case of Alice and John, both in their early 70s. Alice had been experiencing constant itching in her hands and wrists for a few weeks, and she dismissed it as dry skin or seasonal allergies. However, when the itching became more persistent and she began noticing some swelling in her hands, she went to her doctor. After some tests, Alice learned that her heart was not pumping efficiently, leading to fluid retention in her hands and wrists. John, on the other hand, had been feeling similar symptoms but didn't connect the itching to his heart health. It wasn't until his doctor explained the connection that John realized the swelling and itching in his hands were early warning signs of heart failure. The key takeaway here is that persistent itching in the hands and wrists should not be ignored. If combined with swelling, fatigue, or shortness of breath, it could indicate that your heart isn't functioning properly. The good news is that managing heart disease and improving circulation can help alleviate these symptoms. If you experience this kind of discomfort regularly, it's important to seek medical attention to rule out any underlying heart problem. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any video. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 5. Itchy abdomen. Itching in the abdominal area, especially around the stomach or sides, can often be overlooked, but in some cases, it could signal a heart-related problem. For seniors, one possible connection between abdominal itching and heart disease is the buildup of fluid in the abdomen. This can occur in individuals with heart failure, a condition where the heart isn't pumping blood as effectively as it should. As blood flow is compromised, fluid can accumulate in the abdomen, leading to swelling, discomfort, and often an itchy feeling. Additionally, poor circulation in the abdominal area can cause skin dryness, irritation, and a feeling of tightness. Look at the experiences of Tom and Linda, both 76 years old. Tom had been dealing with occasional itching around his abdomen, but he didn't think much of it. Over time, he started feeling more bloated and uncomfortable, especially after meals. It wasn't until he began experiencing shortness of breath and fatigue that he sought medical advice. After a checkup, Tom learned that he had early-stage heart failure, which was causing fluid to build up in his abdomen. Linda, on the other hand, had similar symptoms, but she initially assumed the itching was due to stress or dietary changes. It wasn't until her doctor explained the connection between heart failure and abdominal fluid buildup that Linda realized she too needed to pay attention to these signs. If you notice persistent or unexplained itching in the abdominal area, especially if it's accompanied by swelling, shortness of breath, or difficulty breathing, it's crucial to get it checked out. This could be an early indicator of heart failure or another cardiovascular issue that requires medical attention. Addressing the underlying heart condition early on can help relieve these uncomfortable symptoms and improve overall health. Number 6. Itchy elbows and knees. If you experience persistent itching around the elbows and knees, it could be more than just dry skin or irritation. This can be another warning sign of circulation issues linked to heart disease. When blood flow is reduced due to heart conditions such as atherosclerosis or heart failure, areas like the elbows and knees where blood flow may naturally slow down can become prone to itching and irritation. This is especially true in older adults, whose circulatory systems may already be struggling to keep up with the body's demands. These areas, with their thinner skin and close proximity to major arteries, are particularly sensitive to changes in blood circulation. Look at Jerry and Florence, both in their early 80s. Jerry had been feeling occasional itching around his elbows and knees for a few months. Initially, he brushed it off as a minor discomfort, but when the itching became more frequent and was accompanied by swelling in his joints, he finally sought medical help. After undergoing tests, Jerry learned that his arteries were narrowing, leading to poor circulation in his limbs. Florence, on the other hand, had been experiencing similar symptoms but never connected them to her heart health. After hearing about Jerry's diagnosis, she decided to speak with her doctor. Florence's doctor confirmed that her circulation issues were also linked to heart problems, and she was advised to take steps to improve her heart health. Itchy elbows and knees, especially when accompanied by swelling or discomfort, are worth paying attention to. While they may seem like minor annoyances, they can be an indication that your heart isn't functioning optimally, leading to poor circulation in your limbs. If you notice persistent itching in these areas, particularly with other symptoms like swelling, pain, or fatigue, it's important to talk to your healthcare provider. Early intervention can prevent further complications, including more severe cardiovascular issues. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any video. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts. As we've seen, itching in certain areas of the body can be more than just an irritating symptom. These itches, especially if they are persistent, may actually be a warning sign of underlying cardiovascular issues, such as poor circulation or heart disease. It's important not to dismiss these symptoms as something minor, especially as we age. The body has its way of signaling when something isn't quite right, and it's crucial to listen to these messages. The good news is that many of the conditions that cause these itches, such as poor circulation, can be managed with early intervention and lifestyle changes. If you notice any of these signs, it's important to consult with a healthcare professional who can help identify the underlying cause and suggest a course of action. By taking care of your heart and improving your circulation, you can prevent these symptoms from becoming more serious health issues. If you experience unexplained itching in any of these areas, especially if it's accompanied by other symptoms like swelling, shortness of breath, or chest pain, don't hesitate to speak with your doctor. Heart disease is a serious condition, but with proper care and attention, you can manage it and live a long, healthy life. It's never too late to take charge of your heart health, and making small changes today can lead to a healthier tomorrow. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next one.
Have you noticed an itchy spot on your body that just won't go away? It might seem like a harmless annoyance, but itching in certain areas of your skin can actually be an early warning sign of heart disease. As we age, our bodies can communicate with us in various ways, and sometimes that itch might be signaling an underlying problem with our cardiovascular health. In this video, we're going to explore 6 specific places where you may feel unexplained itching and why these sensations could point to potential cardiac diseases. Understanding these warning signs is crucial for your overall health, and addressing them early could make a big difference. Stay with me until the end, because you might just discover something you've overlooked that could improve your heart health. Now, let's begin. Number 1. Itchy lower legs and feet. One of the first places to notice itching that could be linked to heart disease is the lower legs and feet, especially around the ankles. This area of the body is farthest from the heart, and when blood circulation isn't optimal, it can lead to fluid retention and itching in the lower extremities. When the heart struggles to pump blood efficiently, it can cause blood to pool in the legs and feet, which leads to swelling and discomfort. This is especially common in seniors with cardiovascular issues, such as heart failure or peripheral artery disease. The skin in these areas can become itchy, red, or irritated as the body attempts to deal with the fluid buildup. Take the case of George and Betty. George, 79, has been dealing with swelling in his lower legs for the past few months. He had ignored the mild itching at first, thinking it was just dry skin. However, when the itching intensified and his legs began to swell, he decided to see his doctor. After a thorough checkup, it was found that George's heart wasn't pumping blood efficiently, causing poor circulation in his legs. Betty, on the other hand, experienced similar itching but didn't initially connect it to her heart health. After learning about the connection between leg itching and circulation problems, she started paying closer attention to her symptoms and sought medical advice. Itchy lower legs and feet are often the result of poor circulation, which is a sign that your heart may not be functioning as well as it should. If you notice persistent itching in this area, combined with swelling or changes in the color of your skin, it's important to speak with a healthcare provider. Managing the underlying heart condition can help alleviate the itching and improve overall health. Addressing poor circulation early can prevent further complications, so don't ignore these signs even if they seem minor. Number 2, itchy chest. Itching around the chest area, particularly near the heart, can sometimes indicate an issue with your cardiovascular health. When there's an obstruction in the arteries, such as with coronary artery disease, blood flow to the skin can become impaired, causing irritation. The chest is a particularly sensitive area, and when heart disease is present, it can manifest as itching, discomfort, or tightness in the chest. While the sensation might not seem connected to heart health at first, it's important to pay attention to persistent itching in this area, as it could signal that the heart isn't functioning properly. Take the example of Helen and Martin. Helen, 80, noticed a recurring itch around her chest. At first, she thought it was due to dry skin, but when the itch persisted and she began experiencing occasional chest tightness, she decided to consult her doctor. After a series of tests, Helen was diagnosed with a blockage in one of her coronary arteries, which was restricting blood flow to the skin in her chest area. Martin, on the other hand, had been experiencing similar chest discomfort, but dismissed it as nothing to worry about. He had never associated his symptoms with heart disease until his doctor explained how poor circulation could cause itching in the chest. The chest is often where the first signs of heart disease show up, and it's not just limited to pain or tightness. If you notice consistent itching in your chest, especially along with other symptoms such as shortness of breath, dizziness, or fatigue, it's important to seek medical advice. A full evaluation can help determine if there are underlying heart issues that need to be addressed. By catching these symptoms early, you can take action to improve your heart health and prevent further complications. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. Itchy back of the neck. Another surprising area where itching can signal a potential heart issue is the back of the neck. While it's easy to overlook, persistent itching in this area could be linked to high blood pressure or poor circulation, which are both significant risk factors for heart disease. When blood flow to the neck is compromised, it can lead to a sensation of itching, particularly along the nape. The skin in this region is more sensitive and can become irritated if there is an underlying cardiovascular problem. Consider the experiences of Robert and Betty, both 76 years old. Robert, a longtime smoker, noticed that the back of his neck had been itching for several weeks. At first, he thought it was just an allergy or dry skin, but after a few days of constant irritation, he started feeling a bit lightheaded and tired. This prompted him to see his doctor, where he learned that his high blood pressure and poor circulation were likely causing the itching sensation on the back of his neck. Betty, however, had been ignoring occasional neck itching for months, dismissing it as nothing more than stress or the weather. After hearing about Robert's diagnosis, Betty decided to get her blood pressure checked. It turned out that she too had elevated blood pressure, which contributed to the itching in her neck and overall circulation problem. The back of the neck is an area many of us may neglect, but it's important to recognize that consistent, unexplained itching could be a sign of poor circulation, especially when coupled with other symptoms like dizziness, headaches, or fatigue. The skin on the neck is not just reacting to external factors, but rather it could be reflecting an internal cardiovascular issue that needs attention. If you notice persistent itching in this area, along with any of the symptoms mentioned, it's time to check in with a healthcare provider.